So I have a medical aspiring student who is asking, how many hours do anesthesiologists work? The real answer is that it depends. Anesthesiologists are medical doctors, they are professionals, and they do not have a limitation on their work hours. It will depend on the job requirements or on the group you have joined. Currently, I am in an employment where my typical day is from 7 a.m. to 4 p.m. with 3 calls per month, 1 or 2 late days per week. 7 to 4 is 9 hours a day. Times 5, that's 45 hours a week. And a call could be 7 to 7 p.m. or 7 till midnight or 24 hours. The actual work hours may differ from week to week and whether you have call or you have weekend call that weekend. I have been in different employment models. I held one employment model where my work hours were 7 a.m. To 5 p.m. However, there was no guarantee of actually getting relief, so sometimes you work late until 7 p.m. And this might go on for 3 out of 5 days of the week. So that equals to a long work week. And the call requirement was 1 in 5 days, 6 times a month. Now, I have also been in an employment model where whatever cases you are given, you completed them till the end of the day and you are not given relief, where you committed to working with a surgeon, and on those days that you're working with the surgeon, however long his case schedule is for that day, if he starts work in the morning and it proceeds until 11 p.m., you are stuck doing that. That's your day, that's your surgeon. If your surgeon has an emergency that he adds onto his line of scheduled surgeries, you stayed behind to do that emergency. So I had a time in my career where I was working from 7 a.m. till 10 p.m. for at least 2 times a week. And add to that days when you're on call. The short answer is it really varies. When you're doing OB anesthesia, the day is basically divided into 2 shifts, a day shift and a night shift. A day shift was 12 hours, 7 a.m. to 7 p.m. Night shift was 7 p.m. to 7 a.m. There was also a time in my life where I would do OB about 4 times a month, and that was a 24-hour shift, at which point the next anesthesiologist came to take over. OB is a 24-hour specialty, so there is always an anesthesiologist on site. Now, the anesthesiologists that work in a strictly outpatient setting, and according to their contract model, their work hours may be 7 a.m. to 3 p.m. each day, or 7 a.m. to 5 p.m. each day. It is hard to have a hard stop for anesthesia because you cannot abandon your patients. If you're in the middle of a case, you either have to be relieved by someone competent to take over the anesthesia management of the patient from you, or you had to stay and finish that ongoing surgery. And this is one part of anesthesia that makes it hard to strictly state that, I'll be out at this time. If you want to be out at a certain exact time, you have to take the day off. Pretty much, that's the only way to guarantee that you'll be available. If you had an appointment at 2 p.m. and you wanted to be there at 2 p.m., if you started surgery at 10, that surgery might not be finished at 2 p.m. And the best way for you to guarantee you'll be off that day, take the day off. Okay, now I'm just meandering, but let's get back on point. Early on in their career, most anesthesia professionals want to work many hours so they can make more money and pay off their bills. Sometimes this means that they're taking additional call at their own discretion, and that will add to their workload. If you're working in a group and you're looking at jobs, One of the real questions to ask is, how realistic is it to be relieved from a case? You may want to be relieved from a case, but if the group has few members available on call each night, it may just not be feasible that you will get relief, in which case you have to stay behind and finish that surgery. That comes with the territory of being an anesthesiologist.